Hello and welcome to this instructional video on how to care for your J-vac drain after your surgery. You will be sent home with equipment and the nurse will give you instructions on how to empty the drain before you are discharged. We suggest that you empty your drain in the bathroom so that the fluid can be flushed down the toilet after removal. Firstly, wash your hands and apply a pair of clean gloves. To unvac the drain, relieve the negative pressure by opening the exit plug, the single bung. This will completely expand the drain and you will hear a whooshing sound as the drain expands. You now need to empty the drain contents into the jug or cup provided. Next, clean the plug/port with an alcohol wipe. To revac the drain, with the bung still removed, place your thumbs and fingers around the centre of the drain and squeeze the plates together, ensuring that the central window clicks firmly into place. Next, replace the bung. Then, whilst holding the drain with one hand, pull the bottom paddle towards yourself and the container will pop and partially expand to create a vacuum. Now it can be placed back in your fabric bag. Now measure the contents and write the measurement on your drain output chart. Now you can dispose of the fluid in the toilet, rinse the jug with warm water and then remove your gloves and wash your hands. Here are some tips if you're having any problems with your drain. Please ensure that the internal ends of the bungs are between the two white plates, otherwise it will not flatten so the vacuum cannot be achieved. If they are outside of the plates, try to manipulate them into the correct position so that you can continue revacing the drain. If the drain bag becomes unattached from the tubing, clean the site, put the tubing back onto the left-sided port and then open the right port and revac the drain. The drain fluid may come out of the tubing, so it can get on your fabric drain bag and/or clothing. You may notice some leakage from your drain site. This can be caused by a blockage in the tubing from small clots. To stop this, you or a helper can milk the tubing to move the clots into the bag. Firstly, unvac the drain and place the bung back on so you do not spill any fluid. Next, pinch the tubing near your drain site and strip the tubing. This will move the fluid down the tube. Do not let the tension go as the fluid will go back into its old position in the tube. Continue this stripping/milking of the tubing until you reach the bag. If you're still having problems with your drain or wound after surgery, please ring the ward.